Mr. Chairman, the Support for Patients and Communities Reauthorization Act is critical legislation that reauthorizes and amends several programs that will help in the prevention and treatment of substance use disorders, including bolstering prescription drug monitoring programs and requiring a study on the use of remote monitoring for patients who are prescribed opioids. The safe prescribing of controlled substances and understanding the root causes of substance use disorders are key to effective prevention. That's why Representative Trahan and I led the Medication Access and Training Expansion Act in the last Congress, which requires any practitioner with a DEA registration to complete at least 8 hours of training. 8 hours of training on substance use disorders and the appropriate treatment of pain. The Medication Access and Training Expansion Act was signed into law at the end of last year, and the administration has now begun enforcing education requirements before providers can apply for or renew their DEA registrations. However, it has come to our attention that SAMHSA is not recognizing the training of several major provider groups as being compliant with the new law, including the training of pharmacists, dentists, family physicians, optometrists, and podiatrists. These trainings are pertinent to the patient population served by these providers. Representative Trahan and I recently sent a letter to the agency clarifying congressional intent and making clear that these trainings should be considered compliant with the MAID Act. We are currently awaiting response. I ask that the chair and ranking member commit to working together with us so that all prescribers can receive credit for completing the most appropriate training needed for them to address the opioid crisis. I appreciate the willingness to work with me on this important issue, and I yield back the remainder of my time.
The gentleman yields back.